الأول معلش I'm sorry.
طب اعملها التايمنج من الاول. اوكي
ماشي.
اوكي ستارت.
Okay. Hello, I am Dr. Miriam. I am the doctor in the heart clinic today. Are you Mrs. Vicky Daniel?
Yes, doctor.
Nice to meet you. You are 29 years old?
Yes, doctor.
Okay, Mrs. Vicky, we are here today to discuss some issues related to your health status. Is it all right for you?
Yes, Dr. Miriam.
Okay, Mrs. Vicky, if you don't mind, I will take some notes during our meeting. It will be confidential, and I will give you my full attention. Is it okay?
Okay, Dr. Miriam.
Okay, it came to my knowledge that you are troubled with swelling in your ankle. So can you tell me more about that?
Okay, Dr. Miriam. Dr. Miriam have been complaining of breathlessness 2 years ago. Actually, it was associated with chest pain. Since 2 years, this breathlessness and chest pain came to me after symptom of the respiratory tract infection. And since 2 years, they diagnosed me as an asthmatic patient and gave me some medication.
Okay.
Since this, I complaining from breathlessness. It's annoying for me and chest pain.
Okay. So this is not the first time you feel that before, since 2 years.
Yes. Yes.
Okay. And is it progressive, increasing or decreasing in nature?
Actually, it's came in attack. It came, then increase, then it will be stationary.
Okay. For about 2 years.
Yes, since 2 years.
Do you tell me anything that aggravating your condition, like effort or any diet or anything aggravate your condition?
Yes, Dr. Miriam. Actually, I'm working as a domestic, and during my work, when I have this breathlessness and this pain, I have to stop my work for some time. Then I will regain to my work again.
Oh, I am sorry to hear that. So anything make it better?
No, just rest.
Right. If you lying flat, it will help you.
No,
Okay. Any associated symptoms with you, like sweating, heartburn,
no,
any change in water work, in frequency, in
No.
color?
no,
You have any history of allergy before for drugs
No.
or diet? No.
no, no,
Okay. Do you have associated heart racing?
no.
Okay. About your family history, do you have any other family history before for asthmatic attack?
Yeah. My mother is asthmatic and she's already on medication.
Okay. About your heart, you have any heart incident before, heart attack, anything on your arteries of your heart?
No, doctor. But actually, doctor, I have chest pain.
Okay, this chest pain, can you explain for me more about the site and exaggerated by everything?
Actually, this chest pain come in front of my chest. It's in the center of my chest, and it's increasing with effort. Really, it's annoying me, doctor. I have to take rest.
Okay, and is it associated with cough?
No,
No cough. You have any swelling in your ankle?
yeah, I have ankle swelling up to the lower end of my leg.
And
She
for how
actually
long?
this swelling, doctor, came since 2 months and is progressive.
Is progressive. And what is increase this swelling?
If I stay for long, sitting for long time, this swelling is increasing, doctor.
And
But actually,
what
since
will
2 months,
make it better? Okay.
yeah, actually, since 2 months, it starts in my feet that is now up to my lower limb.
So it is increasing.
Yeah,
Okay. If you're lying flat, it will decrease.
yes.
Okay. Do you take any medication for this problem?
No, doctor. Since I have been admitted 2 years ago and diagnosed me an asthmatic patient, they gave me 2 types of medication. They informed me it will improve my breathlessness in the form of medication to dilate my lung channels, and they informed me they give me steroid.
Do you know the name of these drugs?
Yeah, Bricanil inhaler.
It is inhaler. And do you know the correct way to take this inhaler?
Yes, doctor.
For how many times do you take this inhaler?
Uh, 2 times per day, doctor. Or sometimes I have this breathlessness, so I increase the dose to be 3 or 4 times per day.
Okay. Do you have fever or increase in your temperature?
No, doctor.
Do you have any tiredness or fatigue?
Sometimes I have fatigue with this
Um,
breathlessness.
okay. And lumbus, bambus?
No,
No. Any change in weight, either increase or decrease?
no, doctor.
Any change in appetite?
No,
Any sweating?
no,
Headache?
no, doctor.
Any visual problem?
No,
Do you have any weakness in your limbs or unsteadiness in?
no,
Okay.
doctor.
And do you have any noisy sound in the chest?
Actually, during my breathlessness, I am feeling that my with this chest pain. Sometimes I'm feeling there is some noisy on my chest.
Okay. And do you have any coughing of blood?
No,
No. Okay. Okay. About your tummy, do you have any problem, any pain,
no, doctor.
any change in the bowel habit?
No, doctor.
Okay. And your work water is okay,
Yes, doctor.
not frozy or no change in the frequency.
No, doctor.
Do you have any bleeding from other orifice?
No, doctor.
Any orifice?
No, no,
Okay. Do you have any abnormal feeling of hot or cold weather?
no, doctor.
Okay. And do you have any hand sweating?
No,
Okay. Do you have any problem in the muscle or in the joint?
no, doctor.
Any skin rash?
No,
Okay. Do you have any medical problem I should be aware of, like high blood pressure, high blood sugar,
no, doctor. Rather
and no
than breathlessness and chest pain and this severe annoying swelling on my limb, no,
okay, and no heart attack before, like you said.
no,
Any history of admission in the hospital before?
doctor. Rather than this 2 years ago when they diagnosed me as an asthmatic patient, no,
Okay, and any history of blood transfusion,
no, doctor.
surgery?
No,
Okay. Apart from this inhaler, do you take any medication?
no, doctor.
And no history from allergy from any medication you told?
No, no,
You didn't take any over-the-counter medication?
no, doctor.
Can I ask you a private question? Do you have any illicit drug before?
No, doctor.
Okay. Any shares needle?
No.
apart from your family history that your mother has an asthma before, do you have any other family history related to the heart, or any family history is important to tell me about?
No, doctor.
Okay, do you smoke?
No, doctor.
No smoke. Do you drink alcohol?
No.
Okay. What about your drive? You are driving?
No, doctor.
Okay. And you told me that you are you have a job as a domestic.
Yes.
Okay. And this point is affect your job.
Yeah. When during this breathlessness attack, I have to stop work.
So I will refer you to occupational health to help you regarding this point, and to see if there is a suitable work to do at this moment. Is this okay for you?
Yes, doctor, please.
Okay. With whom you are living?
My mother.
Okay. And you are financially supported?
Yes, doctor.
What about your house? Is it suitable for live, and or there is any animal or birds in the house?
Yeah, it is suitable, doctor, and no contact with animals.
Okay. And what about your hobbies? Are you playing any exercise or any sport?
No, doctor.
Okay. What about your period? Is it okay?
Yeah, regular, doctor.
And no chance for pregnancy nowadays?
Yeah. No, no, no.
No history of abortion?
No.
No history of recent delivery?
No, doctor.
Okay. Okay. So, do you have what about your diet? Is it okay?
Yes, doctor.
Okay. So, can you let me give you a summary for what you are speaking?
Yes, doctor, please.
2 minutes
So,
meaning.
you complain of, you told that you have breathlessness and chest pain since 2 years, but increased since 2 months, and associated with ankle swelling. And you have a family history regarding your mother that she has asthma, and you take inhaler as a drug. Is it okay?
Yes.
So, could you tell me what is your concern?
My concern, doctor, is it a serious condition? Some of my colleagues informed me that there is a blood clot in my lung.
Okay, regarding the first concern is that you that it is a serious condition. I told you that we have to do some tests and some examination to reach a final diagnosis. But if this related to your heart, it will sometimes. I am sorry to tell that it may be serious at that time. That's why we will do for you some investigation to reach the final diagnosis. And regarding the other concerns that you have, that your friend told you that maybe clot in your arteries, I told you it is a possibility, but less likely in this condition. So, do you have any question else to ask?
Doctor, thank you.
So now I will admit you until we improve your breathlessness and your ankle swelling, and we will do some investigation to trace your heart by something called ECG. This is a tracing of the electricity of the heart, and we will do like ultrasound on your heart to show the muscles of your heart and how it is work. Also, I advise
Time up.
you good diet and to do. Okay.
Thank you. Okay, 1 minute دكتورة. return back. احنا نخرج من الميتنج تمام
نرجع تاني.
ونرجع تاني لأن فاضل 2 minutes.
ماشي.
ممكن بلاش تفصل عليه. اوكي مفيش مشكلة.